Are you experiencing frequent bladder infections and you're wondering why? This can be a really confusing thing to navigate. So I just want to say I'm sorry, bladder infections are not enjoyable, and I really hope this video can help shine some light on the topic for you and maybe even help you towards a journey of having less bladder infections. My name's Krista Norwick. I am a pelvic physiotherapist. I have a master's degree in physical therapy and extensive training in pelvic health, including bladder health. If you're experiencing frequent bladder infections, I think the first thing that's really important for you to know is what team you can build around you to help support you with this and hopefully help you decrease the frequency of the infections. So you've probably spoken to a family doctor already about it. You may or may not have received a referral to a urologist. A urologist is a specialized doctor who can look at bladder function in more detail. And so if you haven't received a referral yet and you think you need one, you can always ask your family doctor for a referral. And the third person is a pelvic physiotherapist. Pelvic physiotherapists help you optimize the muscles that are involved in bladder function. And sometimes if your muscles aren't quite working how they should, you might get more bladder infections than you need to be. So your team could be family doctor, urologist, pelvic physiotherapist. Here in Canada, you actually don't need a referral from a doctor to see a pelvic physiotherapist, so you can just go see one right away. You can see one of us if you want. If you're in a different country, then you might need a referral from your doctor, so definitely ask for a referral if you want to see a pelvic physiotherapist. So, why might you be getting frequent urinary tract infections? I'm going to talk about the role of the muscles in this. So I'm not a doctor, I'm a physiotherapist, so my expertise on this topic is with your muscles and how they help prevent bladder infections, but also what might be happening if you're getting them frequently. Okay, so what are the pelvic floor muscles? Well, this is my model of the pelvis. Your front of your pelvis is your pubic bones, your pubic symphysis. Your lower back is at the back here, your sacrum and your tailbone. Your pelvis are these two bones that kind of look like wings here. If you look from above, there's a hole in your pelvis and it's filled with what's depicted here as red pelvic floor muscles. So they're all those muscles that attach on the inside of the pelvis. Your urethra is going to be coming through this area of the pelvic floor. So whether you have a vagina or a penis, your genitals will be here and your urethra is going to be coming out through the pelvic floor. These muscles are really involved in bladder function because in order for you to empty your bladder, they actually need to relax and open so that your urine can pass through, but that also gives a signal to your bladder that it can squeeze and empty its contents completely. So your muscles need to be able to relax completely for you to be able to empty your bladder completely. So what sometimes happens with the pelvic floor muscles and urinary tract infections is sometimes that process isn't working as well as it could. And so when you do go to empty your bladder, you relax your pelvic floor, but maybe you're not fully relaxing it. And what that can lead to is it can lead to you not emptying your bladder completely. And so we call this incomplete emptying. There could be residual urine left over in your bladder after every time you try to empty. And when there's leftover urine, it's actually more susceptible to developing infection. And so if you're someone who's not fully emptying your bladder completely, that could be the reason why you're getting frequent infections. The great news is that you can learn to relax your pelvic floor muscles completely. A pelvic physiotherapist can teach you how to do this if this is what's going on with you. You can learn how to move your pelvic floor muscles with breath by visiting this video here. I'll put one of my yoga videos there for you. And so that's the first step that you could try. However, it is the gold standard for you to see a pelvic physiotherapist who can assess your muscles, make sure that that's actually what you need, and then teach you how to use that new skill of being able to fully relax when you're trying to empty your bladder. The other thing that could be contributing to infections is actually if you're not wiping properly. So you want to always wipe front to back, But if you're wiping back to front, what you're doing is you might be moving some of your bowel particles up to your urethra or close to, and that could cause infection in your urinary tract, which we know as bladder infection. Another reason that you might experience frequent bladder infections is if you use any scented or irritating products on your genital area. Ideally, you wouldn't be using any of these products. You wouldn't be using any, chemicals or scented products or sparkly or anything like that, because that's actually hard for the tissue and that can contribute to developing infection in the area. As I mentioned before, the best way for you to know if your pelvic floor muscles are involved in the fact that you're getting frequent urinary tract infections is to see a pelvic physiotherapist. You can book with one of us by visiting the link in the description of this video, or you can search for pelvic physiotherapy or pelvic physiotherapy in your area to work with someone that you trust. Good luck. I hope you have less bladder infections soon. Have a good one. Bye.